more importantly, I'll tell you about my experience of KOS in the last few months at the Zahra hospital. Because I think we were one of the pioneering hospital that got a treatment up and running. And I'll tell you some, this is the brief that I will go through. Nasal blockage, allergic rhinitis versus non-allergic rhinitis. The management of allergic rhinitis, very brief. I wouldn't last longer than 15 minutes. I don't tend to talk very long. Management of NAR, the role of KOS. And more important, our experience of KOS in the, so far in the UAE. I thought I'd divide it into the good, the bad, and the ugly aspects of KOS. And then what I think is the future for KOS in this part of the world. Because I think it's a different, it's totally different in the UAE in the private setting in comparison to Europe. And the data and the stuff that comes up. Nasal blockage in general is due to a structural problem or a mucosal problem. That's a very broad classification. So if someone comes with nasal blockage, all these things can cause non-allergic rhinitis. It's a big group, yes? But what is coming out now is this autonomic imbalance theory, which could explain intrinsic rhinitis, vasomotor rhinitis, the ones that we don't know what the hell is going on. We put them in this black box, yes? Maybe due to the autonomic nervous system. And we'll see later on that's where KOS comes in. So these are some of the things that symptoms that you can use to decipher if a patient has allergy versus non-allergy. So you ask about, everyone will have nasal congestion, right? So that's common in both groups. So there's a bit of overlap. Sneezing, itchy eyes, runny nose, watery eyes, headaches, itching, ears, nose, and palate. All signs of allergy. If these are present, then it's the allergy. But quite often, non-allergic, the patient may have one or two of these and other symptoms which may fit with non-allergic cause. Yes, it's difficult. Right, I like this slide because it gives a good picture of what's going on in the mucosa. You have the ciliated epithelium, you have all these fancy cells present, and most of all you have these venous sinusoids, which are the key to nasal blockage. And they're actually controlled by the autonomic nervous system. So when you have normal mucosa, this is what it looks like. This is what the sinusoids look like. When you have inflammation, yes, the nasal blockage is due to these structures here enlarging with blood flow. There's also cell recruitment. You get increased immunocompetent cells, and various other cells come to the area. You get glandular hyperplasia, increasing the number of the glands present, and you get plasma exudate. All this forms bulk that increases the size of those terminates that you see. Yes? But the most important thing is the sinusoid. And I think of this slide every time I'm doing the debridement of the turbinates. When I'm using the microdebrider, I'm hoping that I'm coming in here and removing all of these and still preserving the superficial layer. Yes? So this is just to give you a perception of what's going on at the sort of physiological level. Good. Now, in terms of therapy for allergic patient, this is what's recommended by the ARIA guidelines. Yes, depending on the symptoms, you have various chemicals: antihistamine, steroids, chromoglycate, anti-leukotriene, and so on. So, what about non-allergic rhinitis? Well, we know that it's multiple causes. Could be hormone, could be drugs, could be virus, could be anything. KOS comes in as a method to regulate the nerves, a neuromodulator. Yes? And you can regulate the nervous system by 3 methods. You can use electrical stimuli, you can use thermal stimuli, or you can use mechanical stimuli. KOS therapy is a form of mechanical stimuli that neuromodulates, right? That's the mechanism. So it's a vibration that stimulates or resets the nervous system. That's the theory of it. Now we at Zahra, we feel that it has another mechanism. The vibration that occurs for 10 minutes, we think it affects the biofilms that are present on the mucosa that causes inflammation. And therefore, that will cause, if you remove the biofilms, we remove the inflammation and we get a bit more space. Yes? That's our theory, it's not proven, but that's what we believe. Now, there are several studies that shows that some people that have lots of space in the nose, physical space, will still complain of blockage, the empty nose syndrome. And the reason for this is that the sensors in the nose are not working. They're not picking up the pressure of the air coming in. By using vibration therapy, these sensors may be able to be rebooted and reset so that they now perceive the flow of air. And in this way, it could be reduce your pseudo blockage and get a perception of breathing better. Yes? Yeah, so it comes back. And this is probably relevant in lots of our patients who had the terminate trims. We lost a lot of the centers that way. So KOS might be a way of reintroducing, resetting the sensors. So it may be relevant in those patients who still complain of nasal blockage after turbinectomy.
Something like diabetes, right? Plenty of glucose around, but
yeah, starvation in the land of plenty. Right, for those who don't know about KOS, I think we all know about KOS, the actual treatment. It involves a balloon that you insert in the nose and vibrates for 10 minutes. Yes? Anybody not familiar with the actual procedure? We've all seen it already, yes? So I won't dwell too much on that. Good. And these are the benefits, of course, in terms of the patient and the treatment, yeah? Okay, we're not going to dwell. So what's been our experience so far? We've had about a 6-day, for patients that we've treated, we've now treated patients freely and some, a lot with insurance cover. Because we got approval from quite a few insurance companies. The beneficial effect, which is within 1 or 2 days, is about 60 to 70%. We have a problem in our hospital of having manpower to collect the data subsequently. I tried to get my junior staff to do it, but they have no interest. People here have no interest in research, in getting things published, in doing things in a scientific way. It's completely different from Europe. When we were junior doctors, a new project coming, all of us will jump on it because we have to get publications. So we have to get data. It's completely different mindset in this part of the world. No one is interested, including the nurses. I couldn't get them to do it because there's no incentive for them.
Pay them by the company.
Our hospital benefits a lot from us doing the procedure because we have now a CPD code, which is 1,070 dirhams, and the doctor's sort of procedure fee is another 1,000, which is what we got the insurance to approve. Some of them say 900, some of them say 1,000. So in total, it's about 2,300 we charge per treatment. Yeah, and we've been getting approvals from 12 out of the 21 insurance company that we have. I know in Harley Street they charge £1,000, which is about 5,000 dirhams per treatment. And there's a sleep clinic in Harley Street that has the machine, Roe Jones Clinic. We found it difficult to get insurance to approve for 2 treatments on different occasions. However, we feel now that if we ask from the outset to approve for 2 treatments, because the results are better, as our colleagues say, if we are able to give 2 treatments. And one of my colleagues has been successful so far, but was a VIP patient, so I don't know if that will translate to other patients in getting multiple treatment in one request. But people, patients will not pay for cost therapy, full stop. They will not pay out of their pocket. If it's covered by insurance, they will go for it. I have had no patient that said, okay, the insurance did not approve of it, I will pay. It's just a no-no. Okay, so that's some of the benefits that unfortunately for the doctors, our hospital doesn't give us anything, so there's no benefit, financial benefit from the treatment of course in our hospital for the doctors. Right, now what about the bad side? The bad side is that private hospitals, most of them work with salary and what's called incentive, yes? And being surgeons, our primary aim is to do surgery, yes? So surgery is our first choice, preferred choice in any patient with nasal blockage. If we can straighten the septum or reduce the turbinate surgically, because there's financial incentive. We would not pick costs in front of surgery. And that's probably across the board. And a couple of surgeons have already said that they're not interested in cost because we want to do surgery, okay? So surgery is a preferred option. It's lucrative to reduce the turbinates surgically with the microdebrider or coblation or whatever. We have the lack of interest in collecting data and doing proper audit in hospitals in this part of the world is not good, because we should always be auditing what we do. Every aspect of what we do we should audit with a view of what can we do different to make things better. Yeah, that's the purpose of clinical audit. We audit everything and say if we can make a change to improve patient outcome, we should do that. But it doesn't happen here. No one is interested, there's no time. Time is another big issue. We see plenty patients in our clinic. I see a patient every 10 minutes, some people every 15 minutes. And there's no time to even scratch your head sometimes. Yeah, so time is also a very issue. When you'll get time to focus on this, to collect the data, to think about analyzing it, to think about writing it up, there's no time. Right, now the ugly. What's on to my slide? You need to get this bit at the bottom.
Maybe enter, doctor, enter.
Enter. Okay, these are the insurance companies that approve cost therapy. Yes, it's 12 of them.